for patients, we're painting a picture of like possibility and hope. It's our job to convey
Yeah.
to them, hey, this is how life could improve for you if you were to take this first step. Our goal is to like really meet them where they are. And on average, it takes people 11 years to seek help from the onset of mental health symptoms. And that's just far too long.
Welcome to Creative Health Tech, your dose of strategic creativity from the mind to push the boundaries of the health tech industry. We are your hosts, Rob Marques and Felipe Silveira, founders of Mobi. Today, we're diving into the role of storytelling, educating, and generating trust around mental health. Joining us in this episode, we have Kelsey Chacon, content manager at Rula. Kelsey, welcome to the show.
Thank you for having me. I'm excited to be here.
We're also excited to be talking to you. And usually we like to understand how our guests got to be where they are, like how you started your career, how do you end up doing content management at Rula today?
Awesome. Yeah. So I actually started my career working as an editor at a medical publishing company. I initially wanted to go into the publishing industry and eventually become a book editor, actually. But breaking into the publishing world is really competitive.
Mm.
I was living in Nashville at the time. And this was all like pre-COVID, so remote jobs weren't really much of a thing yet. And, at the time this medical publishing company was hiring, it seemed like a great way for me to kind of like sneak my foot in the door in a roundabout way. But after living in Nashville for about a year, my now husband and we moved to Philadelphia, and I was able to get into B2B SaaS tech company as a content writer at this point. I was kind of the efforts to go after this like lofty publishing career. I was feeling like, again, highly competitive industry. We were living in Philadelphia at the time, pre-COVID. There just weren't that many opportunities there. So I was like, all right, let me see how I can kind of segue my writing and editorial skills into, bring in my marketing background from my college days and go from there. So that's where I found myself at this, B2B tech company as a content writer, writing everything from like social media posts to email drip campaigns to case studies. And it wasn't riveting subject matter for me, but I did find the process of turning like really technical content into something more digestible, like really challenging and fun and even a bit creative at times. So from there, I moved on to a medical translation and interpreting company. So this was like going back to my healthcare beginnings. I started
Yeah.
as a like marketing associate and eventually led a small team as the content strategy manager by the time I left that role there. But again, I found myself like translating, no pun intended, complex like technical information into more digestible marketing assets that could really resonate with stakeholders that are unfamiliar with the intricacies of interpreting and translation technology, right? I
Was a
spent like,
different role from writer and editor to translator.
Yeah.
oh yeah, completely different. So I learned a lot there. I spent nearly 5 years there. And that's definitely, I credit my time there with, how I was really able to hone in on my ability to weave
Yeah.
storytelling into marketing collateral.
Hmm.
Quick like trigger warning here for subject matter related to suicide, but I mean, we are talking about mental health care here. And I think it's important to understand like how I got to Rula and why mental health care is so important to me. So while living in Nashville, my now husband's sister took her own life. And it was around this time that my older brother was also diagnosed with schizophrenia. So suddenly mental health was like my whole world. It was like all I could think
Yeah.
about. So it was during this time I really began to feel like a pull toward work that felt more meaningful and personal and like mission driven for my own personal mission.
Hmm.
So into Rula, like that's kind of how I
Yeah.
ended up here is like I really, wanted to find an organization that I felt like cared like mental health care as deeply as I did, but where I could take like my marketing communication skills and try to like make a difference.
Yeah. And I was going to ask because, like you mentioned, that like storytelling is
Hmm.
something that for you, like it's what helps you to get the complex topics into digestible stuff. But like, how does you feel like storytelling looks like, and how important it is for mental health communication and for the mental health context?
Yeah, so I mean, my time at the healthcare interpreting company really made me realize that there's like nothing more intimate than healthcare, right? Like, I mean, you hear all the time like health is wealth, right? It's like really critically important. So, in my previous role, we were trying to convey to health systems and hospitals like the critical importance of receiving care in your own language. I mean, there are like literally times where it could be life and death if, the right message isn't conveyed at the right time. So we were trying to enact change with our solution and help people get the care they need and deserve, regardless of whether they spoke English or not. And mental health care is really much the same. I mean, for some, receiving the right care at the right time can also be like the difference between life and death. One of the most basic like marketing principles is to find your audience's pain points, right? And to speak to how your product or service can help. And in some industries, you can be really like blunt or cheeky or sarcastic,
Yeah.
but in a mental health context, the storytelling needs to be really compassionate and sensitive and feel very trustworthy. So at Rula, our audience includes both patients and partners, so like when I speak to partners, I mean like picture like health plans and insurers or employers who like might offer their employees like a mental health benefit. And then for patients, we're painting a picture of like possibility and hope. It's our job to convey
Yeah.
to them, hey, this is how life could improve for you if you were to take this first step. Our goal is to like really meet them where they are. And on average, it takes people 11 years to seek help from the onset of mental health symptoms. And that's just far too long.
Yeah, it's super far, far as long. And how do you balance actually being, empathetic at the same time being informative when dealing with such topics that has just high emotional charge attached to it?
Oh, man, yeah, so, like, a big part of my role is making sure that our content speaks to people, like, where they are, and often that's
Hmm.
times when they're feeling, like, really vulnerable or uncertain or overwhelmed, and, I mean, Google search, like, people will Google, like, the most personal, intimate things, right?
Yeah.
Like, looking for, in their darkest moments or in their most vulnerable moments, looking online for answers. I mean, I'm sure we've all gone down Reddit, rabbit holes, but it's really important to balance empathy. You start from a point of listening. So we spend a lot of time understanding not just like what people are searching for, but what they might be feeling when they're looking for
Hmm.
it.
Hmm.
So that allows us to use a tone that acknowledges those emotions without being too heavy handed. And then,
So it's not just the content itself that they're searching, but how they might be feeling when doing this
exactly.
search. I think this is a big thing to think about it. And just
Yeah.
when you're writing and you make sure, you're not just being formative as
Mm,
you have to be, but being um, mindful and empathic with the personal receiving end that might be that specific situation, and you need to make sure the message goes across not only again not only the medical jargons and this kind of stuff we know people can simply relate, but how it connects them, connect the emotional level. It's pretty powerful.
Yeah, also
yeah.
because like I feel like sometimes when you're searching for something in a state of mind, you can be too reactive. So I think that a lot of the things that you need to do is kind of hit a break and let the like kind of welcome the person into that, and that's why I feel like storytelling is so important. Like when you put somebody into a story, you kind of take them from that mindset, that worry that they have, and they kind of go to the pace that is set when you're writing or when you have a video or something like this. So we kind of can ease that person into the information without presenting the information and them kind of getting that extreme reaction. Although because like a lot of times when you said when we Google stuff, they're usually bad stuff. Like usually the Google search is usually worse than a lot of the situations. So my mother, she usually tells me something like I say like, oh, I have this, and she said like I put this on Google. I'm like, don't do that, please. You're
No.
just going to stress yourself out, and you're going to stress me out. So, yeah, I think that the like being delicate in the way that you deliver and how you receive that person into the place that we inform is really important.
Right. Yeah, we're trying to, like, validate their experience, and balancing, that validation, but also providing a really trustworthy, actionable guidance, and, ultimately, we're trying to reduce the stigma that, often prevents people from seeking help, so
Yeah. Yeah. And how do you approach like the challenge of making this type of content also engaging, right? Especially, this type of audience in mental health that might be impacted by different types of feelings, but also different types of contents that is there everywhere. So how do you get this good content, good information, but at the same time engaging for the receiver in the end?
Oh man, yeah, great question. So I think social media can get a really bad rap, but I mean, especially right now. But I
Yeah.
think one of the more positive marketing changes I've seen come out of social media is how, like, popularized, like, a very conversational tone has become when it comes to
Hmm.
content. I think that's one thing that we do very well at Rula with our patient-facing content. Our other content manager, Jen Lair, she is amazing. She has put extreme thoughtfulness into developing our editorial style guide. Like I mentioned earlier, our goal is to meet patients where they are. So not just through
Hmm.
marketing channels they might be on, but also like through the messaging. Like we said, how they're feeling emotionally when they're coming across this content. So it's really important for us to avoid like clinical jargon that might slow the reader down. And we want to remain optimistic, but we also don't want to sugarcoat things, right? And we want to come from a place of empathy. So I think like owning that very like conversational tone and voice has helped our content to feel really welcoming and engaging with the reader.
Hmm.
And then aside from just like the actual written content itself, we have like just the most amazing team of designers who approach the visuals of our content in a really equally thoughtful way. So I think it's like the marrying of all of those, creative efforts that can help the content be more engaging.
Yeah, and I like what you said in terms of the social media that, uh, in a way, welcomed more of this personal connection, or let's say less produced stuff. And this is something that we saw actually with our friends that run production companies, produce more like live action kind of stuff, and how content changed from the companies needing to show the high value production of the videos they're producing, and now it's more about like how personal it feels when engaged with some of those type of contents. And I feel like it also helps to get the message across and make sure it reaches the wide audience.
Yeah, and I think, like, we also I mean, we are so inundated with, like, advertising, right? Like,
Hmm.
that it's become a lot of times, like, the more polished something looks, like, the less trustworthy it seems almost. It's like, "Why is this so overproduced?"
Yeah.
I wanna feel like I'm talking to a friend or, like, a trusted, individual versus, like, feeling like I'm being marketed or targeted
Yeah.
by a large organization.
Like, are they
Yeah, yeah.
hiding something? Do they have to
Right?
invest that much money to produce something like big?
Right? Yeah, I think too, like a lot of our content, again, like we have an amazing social media manager, and she does a really great job at working with therapists in our network who to provide, user generated content and have them talk to patients directly. A lot of these people on social media maybe haven't ever gone to a therapist and they don't really know what to expect. So, like being face to face with somebody like that and kind of seeing them oftentimes like in their own space, like how we're all probably at home right now, can be really humanizing.
Yeah, yeah. And actually like, that connects with the question that I had because when you're writing, when you're producing something for really sensitive topics, like my perception, your perception, sometimes like if you're not facing the same problem, we don't have the sensibility to maybe understand the intricate details about maybe how it is to support somebody with a cancer. And I was going to ask, how do you manage and leverage the kind of co-creation with therapists or with patients, and you mentioned right now like with people on social media, like to kind of interview and try to understand the best way to talk to them.
Yeah, I mean, so we're really lucky at Rolla to have an incredible product marketing team, and they're continuously like conducting research and talking to our patient and provider populations. So the content team, we're like regularly provided with updated sentiments, whether it's like recorded interviews, like they will hop on a call with some of our providers or some of our patients who are willing to speak with us to gather that feedback, versus sending out a survey. Sometimes it just helps to have
Hmm.
this like conversation like we're doing right
Yeah,
now.
yeah.
But we also, conduct surveys and get sent feedback from other loops. We also have like a clinical team on staff who we lean on when producing content. So these are people who have practiced therapy and worked with patients, and so we're able to lean on them. But the beautiful thing about Rula, I think, is that like a lot of the people who are working there for a reason. They might have a background like I do, where they've been
Mm-hmm.
personally touched by, mental health conditions. And so they're happy to jump on a call and help fill any knowledge gaps. So that's really how we work. And that's how I've worked in all my previous roles, is just like, hey, can I like jump on a call with you? Or like, can I find some time on your calendar to understand this better? And just having conversations like we're doing right now, I think is the best way to gather those insights
Yeah,
from the people
yeah.
that we have as resources.
And how do you measure, or what are the things that uh, your team is looking constantly in terms of improving for content at Rula?
That's a great question, because content is such a it can be a really tricky thing to measure at times. I mean, the hard numbers that we look at are, clicks, views, engagement, downloads, backlinks, placements when it comes to PR, sessions to the website. But we also conduct surveys to capture like brand sentiment and see how Rule is
Mm,
measuring up against competitors. That's something that we've been working to formalize over the past, especially like the past 6 months to a year, is really looking at how we fit into the market based on surveying people and finding out like, A, have you heard of Rula? Do you know what Rula is? B, what comes to mind when you hear Rula? As the mental health industry has become like a really competitive and crowded space. So it's important to go out, I think, and like get those survey results and see like how we're measuring up against like all of the other folks that are out there.
yeah, yeah, it's awesome. And are there any surprising sights or learnings that you remember from those engagements with those stakeholders?
Yeah. So, as I kind of mentioned, we have a clinical team on staff. Those folks have, worked with patients. And then we also stay in good touch with our provider community, so our therapists and the psychiatric providers that we work with. And one of the most surprising things that I've learned is just like how taxing and isolating that providing mental health
Mm-hmm.
care can be on those people. So like other healthcare fields, they're dedicating themselves to their patients too. But unlike working in a physical hospital or doctor's office, a lot of times, since COVID, like these people are working at home as well. Like they're all working remotely. They're providing sessions on their own in their houses or their apartments. And so they are also lacking, some social interaction and engagement with colleagues. So that's something that I didn't really think about before. Not only is like the subject matter that they're like the conversations that they're having like pretty heavy every day with patients, but they're like on their own at home too, feeling kind of isolated. So that's something that I think Rula thinks about a lot, is like how can we make our providers feel more connected and supported, because it can be a kind of lonely professional field, I think.
Yeah. And again, Kelsey, as you talk about reaching the audience where they are, is repurposing a part of our team the strategy? Like, what is generally your type of core content, and how do you adapt it into those platform specific formats while still staying true to Rula's voice and mission?
Yeah, repurposing is absolutely part of our strategy. And I think I mean, any marketer will tell you, like, yes, you have to repurpose content, right? Like, if we're dedicating the time and resources and research into a piece, like, we're going to want to make sure we're able to extend the life of that piece by breaking it into other types of content. I'll use like a recent example. May was Mental Health Awareness Month. And as you can imagine, it's like a very noisy month for our industry, right? Like everybody's trying to be, a part of that and get eyes on themselves for that. So we wanted to make sure we're like bringing something new to the conversation. So we decided to put together this like Rula led research report. We wanted to interview like real people. We conducted a survey, like over 2,000 people, put together a report on the state of mental health care in America. So from there, not only did we want to provide this PDF report, but
Mhm.
we wanted to pull a lot of the key findings and produce like blog articles and snippets of information that lent itself well to like graphs and pull quotes for social media. We synthesize the findings into a webinar and one pagers for like our partners. So the list really goes on, and not all of our core content, I would say, would is as in depth and substantial as that like single report was. That obviously had like a lot of nuggets and a lot more went into that, but we do practice like those same tactics when it comes to our content repurposing strategy. Like if we're going to pull together a case study or, um a smaller kind of report, um, it's gonna take research, then we also kind of apply those same tactics, but just on a smaller scale. So, like, how can we take the information that we've gleaned from this and use it across channels?
Yeah, and I usually your teams usually think about a piece of content already planning all the
Mhm.
different ramifications of it, or
Yeah.
sometimes it happens more on the go. As like, look how good it is. This can
Mhm.
actually become more and more and more because that's something that we see ourselves many times. Sometimes even with the podcast here, as like there are many conversations as like, oh, this can be the full episode, but also like this way that we can bring this further and reach more people because was so good in terms of information and how informative it was.
Yeah, so we will usually start from a place, right? Like when we're planning a piece of content, we're already thinking about, all right, how can we fit this into our overall integrated strategy, across multiple channels? It's not just going to be a report that we put on a landing page
Sure.
or a blog article that's gonna go live and then sit there. We're already kind of thinking about how we might be able to sparse out this content and leverage it across different marketing channels. I think that's what's really exciting about marketing is sometimes like when you're in the process organically, like you might come up with like, oh, this would actually be like a great video series.
Mhm.
Or we should talk to like let's find some mental health care influencers and see what they think about this and see how we can like bring them into the fold of this conversation. So when that happens organically, I think that's really exciting. But there's always I think an initial plan and then things might happen throughout the process.
Yeah.
Yeah,
And
awesome.
then it's the creative process just happening.
Yeah.
Like for you right now, like looking at the horizon, like what do you feel that you expect in terms of changes or like trends, or like how do you feel like things are going to evolve in the communication in this space?
Yeah, I think, we touched on it a little bit talking about social media and like conversational tones. I think that authenticity is going to be a
Mhm.
big focus moving forward. We've already seen it happening, but I think people are really craving transparency, not just the highlight reel, but the journey, including like all of the challenges and bumps along the way. So, like, when brands can show both the wins and like the real work it takes behind the scenes, it can build trust and cut through the noise. Less about like selling a product and more about connecting with people on a very
Mhm.
human level. I think that's what we're starting to see a lot more of. Um, is like, you know, people showing like the what's going on in the background of their lives, not just like how they're presenting themselves online. And I think that's something that our social media manager is thinking about a lot
Mhm.
and something that we're thinking about a lot as we, talk to providers and our patients.
It is awesome because being authentic is something that I since I know about like social media creating contents, it's been always a thing. But I feel nowadays more and more, it's actually a thing as
Yeah, it's step one. It's trying to be
Mhm.
as authentic and like kind of building trust to transparency instead of trying to create a scenario or like trying to sell. Like you're
yeah,
firstly
and
trying
we
to
can
communicate.
and we can even say that of all the AI boom and AI using content and stuff, because it can create a polished version of something, but like this journey, it's only something that humans can produce and that humans can relate. So being authentic at this point as well, and not be showing only, like I said, the polished product at the end, but the journey and this connection between the what is being produced to why it's produced. I feel like it's really, really powerful. And I agree with you. Like it's something that we need more and more and more. And so Kelsey, I wanna thank you so much for sharing your experiences with us. And also for anyone that is watching or listening to us, if they want to connect with you, like where should they go?
You can connect with me on LinkedIn. I love seeing what people are doing with their work there. And you can also check me out at kelseychacon.com. That's where I have some samples of my work and just a little bit more about me.
Awesome. Thanks so much, Cassie.
Thank you for having me.
Okay, so thanks for joining us. Subscribe to keep up with our next episodes. And if there's anyone you'd like to see here in the podcast, let us know at chc@moe.studio. See ya.